Hi, my name is Brian. Welcome back to the fifth video of my prone positioning in ARDS special video projects. This is prone positioning. We will be discussing the more in-depth side of it and more detailed explanation of it and how it's done and what we do it for and the clinical manifestations that we see of improvement. So prone positioning, it's the physiological rationale for prone positioning. It is to improve oxygenation by redistributing the airflow more evenly, even though especially in dorsal lung regions, even though we have this reduced in our ventilation to perfusion, there's this mixed match due to ARDS. So by reducing the pleural pressure gradient, we are leading to better ventilation to perfusion matching and minimalizing lung compression from the weight of the heart and abdominal organs. And it's just one thing about the physiological trait of our lungs is that our lower postural bases of our lungs are actually a lot larger. There's a lot more of that surface area expanding there. So if you're just laying on your back, you really are occluding, especially if you have ARDS, you're occluding a lot of that with the mucus and the sputum production. So when you're flat on your stomach, it's evenly spread out and you have that larger surface area for that ventilation to perfusion matching. When compared to supine position, essentially it allows for more lung aeration and reduces the risk of atelectasis in dependent lung areas. Prone positioning is indicated for patients with ARDS, obviously, when they require an improved oxygenation. Typically, when conventional ventilation methods fail to reach that adequate blood oxygen levels, then the goal is to potentially reduce mortality by improving ventilation to perfusion matching within the lungs throughout a better distribution of air in the dorsal lung regions when positioned face down. So what are the contraindications for prone positioning? This could include unstable spinal fractures, open wounds, so on and so forth, severe burns to the chest or abdomen, so it really constricts your chest movement. And again, with severe burns, they turn into these, the skin tissue can turn into rough, kind of ragged, not able to really expand on its own. If you have it in recent tracheal surgery, esophageal surgery, or if you have an increase in intracranial pressure, if your vital signs are not stable, or your hemodynamics, unstable pelvic or long bone fractures, and any number of bleeding or massive hemolysis. Essentially, in a condition where positioning prone could be improving existing injuries or instability, or not improving. So, continuing with prone positioning, we have a chart here that shows kind of the checklist of what you need to do in order to prepare pre-positioning of a patient. So you'd really want to check their respiratory. You really want to check with your respiratory therapists, your lead nurses that are with these patients, because you're going to need more than just yourself to do this, especially if they're on a ventilator. So several pre-term considerations will include assessing your patient's stability. Are they saturating well? How's your blood pressure? Are they tachycardic? Are they bradycardic? So you want to make sure that they are stable enough for you to flip, even though it's just a minimal movement to us. We are severely changing the lung environment for them. You also want to secure all lines and tubings. You don't want an accidental extubation, or you don't want an IV pulled. So the primary role during the turn is to maintain airway patency and closely monitor the patient's respiratory status throughout the procedure. That is us as RT's jobs. That is the most important. We want to make sure that they're oxygenating well, that they're still getting their ventilation, and that they are still hooked up to their ventilator. A prone position therapy checklist should include patient assessment, team preparations, equipment gathering, positioning details, monitoring parameters, and post-prone checks. You want to ensure everything's in the proper position, and you also want to focus on airway management. Again, you don't want that to self-extubate or accidental extubation there, especially if a patient was already hard to intubate to begin with. So you want to, pardon me. You also want to check the skin protection and continuous monitoring of the vital signs throughout the procedure. Again, you really do want to make sure that the patient's in a comfortable position. They are not occluding their own airway by resting their weight on it, or to make sure there's no pulling, tugging of the skin, because breakdown can happen super fast, especially if it's a high pressure tug. So the rotoprone bed, this is a bed that's specifically made for patients that need to be prone. It makes it a lot easier, but it's something that you don't see usually. So it is specialized in medical bed designed to easily rotate a patient from a supine to a prone position with a touch of a button. So it's very easy to use. The setup is fairly simple, but just getting your patient in there can be a hassle. Allowing for controlled prone position therapy, often used in clinical and critical care situations to improve oxygenation. You also ensure proper patient securing, utilize the bed controls panels to initiate the rotation, and you also want to monitor lines and tubes throughout the process while maintaining a dedicated healthcare team nearby to manage any complications. Again, pulling out an IV, if you have such bad blood pressure, and medications that you need, or the fact that you're on a ventilator, and if you get disconnected, you can lose your recruitment, and so on and so forth, reducing the time of recovery. So just to process a more detailed step-by-step technique of this, you would first need a minimum of 2 trained healthcare professionals, which will be either you as an RT, a nurse, or 2 nurses or 2 RTs. So this is just to make sure that everything's present, all the procedure during, before, and after. There is safety and management of any potential issues that could arise. Preparations like secure all patient lines, tubes, appropriately use the bed's tube management system. It's either going to be at the foot of the bed or at the head. You want to position the patient in the center of the bed with proper padding and support for pressure points. Check patient stability and vital signs before initiating rotation. The rotation process. Utilize the hand control unit on the bed to select the desired prone position. Select or slowly rotate the patient into prone position, monitoring their response and adjusting as needed. Ensure the patient's head and neck are properly aligned and supported during the rotation. Again, you don't want anything to get nicked or in some way or form to, you could hurt the patient, either having an IV pulled or extubating them accidentally. So now you would want to just monitor, continuous monitoring their vital signs, their SpO2, respiratory stability throughout the whole process of the proning. So check for any signs of discomfort, again, skin breakdown, complications like hypotension or arrhythmias. You definitely want to keep an eye on those just in case that might happen. To ensure breakdown occurs, placement of towels, pillows support the body from any awkward angles that the prone position could be putting them in. Same for artificial use. Again, you don't want to be just laying flat on your tube. You need to have some space for your tube to be positioned correctly without losing that tidal volume due to resistance and dead space. Alrighty, thank you.